So what we're checking here is we're checking the posture of Joetta here, and when the atlas bone, which is up in this area, shifts out of place, the balance of the head is shifted, and the rest of the spine starts to shift, which causes the shoulders to tilt and the pelvis to tilt or twist. So if you want to come over here, you can start seeing what I'm talking about. We're going to check the balance of the head, balance of the shoulders, balance of the hips. What I'm measuring here is the difference in leg length, which is going to happen. One leg will become shorter than the other when the spine has shifted out of place. And in Joetta's case here, it looks like the left leg is slightly shorter than the right by about 3/8 of an inch. Okay? Let everything relax there to your side. And now we're going to take a look and see what kind of where we're at with her posture. Okay, now already when I look at her hips down here, the hips when I began were torqued like this.
Right.
You see now they're flat. That's all come from a correction up in here, getting the head on straight. Also now the center of the base of the spine and the head is directly over the base of the neck, and that's directly over the base of the spine. These 3 points. So we have that. Now we'll check for levelness. Looks like we've got just a little bit more to go. And I'm seeing that there's just a little bit of tilt to the shoulders.
Yes.
And I'm seeing that the hips are leveling out very nicely. Okay, but we've still got a little issue here. Okay, so that indicates that we're not centered with the head totally yet. Tells me with that shoulder not leveling out, or the shoulders not leveling out, that tells me that we need a different direction of pressure. Okay? So I'm going to try this again. I might come over this way here. And so the last time when I adjusted her, use this ruler here. I adjusted her, we had an angle where we were slightly forward and slightly down. I'm going to come down further with my the way that I stand, and my arm position is going to be lower because I just feel like we need to be lower here. So last time I was kind of through here, we're going to come down further this time. Okay, just another couple little nudges.
And doctor, you don't feel as a patient, you don't feel anything.
Who, Joetta?
Yes.
Yeah. Okay.
It's really gentle.
We'll have Joetta set up and then she can talk about that.
Joetta, did that hurt?
No.
It's pretty gentle, isn't it?
Very.
Yeah.
Excellent.
Yeah.
Excellent.
Good. What was it like when you first came in? Were you in a lot of pain?
I
Wasn't able to walk very well.
I was off center.
Okay.
I had bad injury. Excuse me. Bad injury about 35 years ago. I've been to all kinds of chiropractors in different states and everything. Dr. Vince is the only one that knew what to do to get me back together.
That's how I feel. I'm one of his patients too. That's excellent. Yep.
Absolutely.
It doesn't hurt.
No.
He doesn't pop your back or anything. It's wonderful.
No bone crushing.
Right. I've been there, done that too.
So have I.
Yeah.